What's the first thing that any patient who shows up to the ED with those vital signs gets? Somebody comes into the ED, 68-year-old male who has shortness of breath, they're tachycardic at a buck 20, their blood pressure is 72/40, and they're satting 90% on room air. What's the first thing that any patient who shows up to the ED with those vital signs gets? Fluids, good. So even though that upsets me, that most people get fluids, the reality is that might not be the wrong thing to do when you look at things from a statistical standpoint. The reason why is when you look at patients who are in shock, the distribution of the patients who come in shock, the vast majority of them are distributive shock. That's why CMS cracks on everybody, makes you give everybody 30 cc's per kilogram, which unfortunately will cause harm to our cardiogenic shock patients. But when you look at the other types of shock, cardiogenic and hypovolemic are each at 16%. And the one that people always seem to forget is obstructive shock. You know, when you're first learning shock, everybody forgets about obstructive. Well, the reason for that is it's actually the least common at only 2% of shock cases.